I'm going to introduce our last speaker of the session, Kathy Cochin. So I just met Kathy through GCDI this past year, and she has become an invaluable addition to our group. I think Juha and Rob, you were the brain children behind bringing you in. And Kathy is, as you see on the booklet, she is the CEO of Jasper Inclusion Advisors. She's been in healthcare. You were the head of the Pacific Islander American Health Forum, Asian American Pacific Island, and also in the Advisory Commission on Asian Americans in the Obama administration. And mostly, she's been an amazing brainchild behind this session and super insightful. So without further ado, Kathy.
Thank you, Yanghee, and Aki. I'm also the same height as Yanghee, so I'm going to stand here a little bit since I don't even have slides. I actually have a personal connection with gastric cancer, and it was really, really interesting because as I got engaged working with GCDI as a policy advisor, I just took it as like, okay, this is, because I do consulting and advising, I just took it as like, okay, this is just another health policy gig. And as I got into it, I started realizing my paternal grandfather died from stomach cancer. My father had it when he was 80. And so I'm like a poster child for Kaiser Permanente, where I was 50 years old, went to get my colonoscopy. I'm in the procedure room. I'm all cleaned out. And I say, hey, doc, can you throw a scope the other way, too? I have a family history. They're like, sure, we can do that. So they didn't find anything then, but then I had a polyp. So I had to go back 3 years later. And then I say the same thing to the next doctor. And they said, well, you shouldn't do it all the time, because if there's no indication, there is some risk. You shouldn't get it done all the time. But we'll do another one. You'll have a procedure baseline, and then we'll move from there. And now I find out I have metaplasia. So, and I'm a Kaiser patient. I have a family history that's documented. No one ever said anything to me about getting an endo. It's just because I'm a public health professional, I figured might as well get it. So I totally get the issue, and it is very personal for me. But first of all, I really want to acknowledge Aki and Hope for Stomach Cancer. I worked as an advocate my whole career, 45-year career, and in the last 12 years that ended in 2021, was an advocate in federal policy. I know how hard this is, and it really takes so much vision and dedication, and it really is like pushing that boulder uphill all the time. But it is so important, as we've seen from your work, we've heard from Lauren and Michael, how important it is to have people go to their policymakers, go to the media, and tell their stories. And what was really powerful about Representative Caraveo is she heard the patient stories. There wasn't even an ask to write a bill, but because she's a physician, she did write that bill. And it was the first time that we know of that there was a congressional bill, there still is, still in the House now, that looks to stomach cancer prevention and action. So it is really, really important. And then for all of you, you may have a personal patient story, but as researchers and as physicians, it is also important for you to get engaged. Because I have seen when I've been in Sacramento doing advocacy or in Washington, D.C., patient stories are very important. They speak to the heart. But policymakers also want to have the knowledge that you all have in your heads and your hearts. And I have seen time and time again, especially if a physician shows up in their white coat with a stethoscope around their neck, that a member of Congress will sit down and listen. And it does have a great power for you to also go to your district office if you can't go to DC, or to go to DC on the advocacy days that Hope for Stomach Cancer is going to have in February, to really tell your story. This is where we all come in, where we can all get engaged in policy change. And so let me just tell you a little bit about kind of the status of where we are with the Stomach Cancer Prevention Early Detection Act. So it is currently in Congress, but this session is ending next month. So that means the bill dies. So that means starting in January with a new session, 119th session, that we're still waiting to hear who's going to be in the House and who's going to be in the Senate, we need new champions and new co-sponsors. Representative Caraveo herself is locked in a count. It looks very tight. She may win, she may lose. If she wins, then we've got a great champion, and Judy Chu as well, that we heard from for the chair of the Congressional Asian Pacific American Caucus, is also a sponsor, as well as the Republican Representative Joe Wilson from South Carolina. If Caraveo doesn't win, perhaps it's Representative Joe Wilson who might become our champion. But we have to tell our stories in order to find those next set of champions to get another bill introduced. And in addition to that, you have to get a lot of sponsors on the bill to be able to get it out of committee and then onto the floors and get voted on in both the House and the Senate. So it's a long haul. It's an important first step that happened this year, but the more that all of us can get engaged, the more likely that something can move forward. This first bill was it was a baby step. And Caraveo's office recognized that in the future, if there was another opportunity, there could be more specific language about specific actions, funding, things that will actually advance the work even more. So it is really important that we as a whole group organize, especially over the next year, to see how we can engage in the policy education arena. And that's really what it's about. It's about telling your story as a patient, as a clinician, as a researcher, how this has impacted you, your career, your life, your family. And it's to just tell that story to policymakers, to the media, and as we saw in both Yanghee's presentation and the earlier conversation, and also to do the community awareness, because we have to get people in to whether it's a clinical trial or to the care that they need. And as I said, if visits in person aren't possible, do phone appointments then. Go to your local district office. I do want to just quote what Representative Caraveo said in her remarks that were shown during the break. It is very important that you as patients, as providers, as researchers, come to policymakers like myself to tell your stories. These can translate into action, which can protect all Americans. So I'm going to end it there, and then we can have a conversation.
Absolutely.
Thank you.
Thank you, Kathy.